Hello, everybody. Welcome to this episode of my podcast. Today's topic is connective tissue grafting, otherwise known as gum grafting. And today my guest is Dr. Scott Cohen. Dr. Cohen is a board-certified periodontist, which is somebody who does a lot of gum treatments, gum surgery, anything involving the gums. Scott, I do know that you did your training, your specialty training at University of Washington in Seattle. So it was not even a week and a half ago that Seattle was not able to double up and have a Super Bowl back-to-back victory. So I know you're in mourning. Thanks for being here for the interview.
Yeah, it worked out okay because my dad's side of the family is from the Northeast and his sister lives in Boston. So we won both bets. It worked out.
Okay, very nice. Okay, well, let's get right into it. Tell me, what are the main reasons people are seeing you, whether they're being referred or whether they're coming to you, if they're at home, they're seeing something in their gums? Why are people coming to see you mainly for consultations or for gum grafting?
Right. Most people present to our office for gum grafting after being referred by their general dentist because gum recession is an issue. It affects about 50% of the population, and that increases with age or maturity. Thankfully, this issue is most of the time asymptomatic. People don't know they have it, so often their dentist or hygienist are the first ones to notice it. So we're concerned about gum recession because when patients are losing the gum tissue around their teeth, they're not just losing the gum tissue, they're also losing the bone as well. And we're not very good at growing back the bone. We're better at growing back the gum tissue. And we want a nice firm band of attached gum tissue in the area to protect the underlying bone. So that's the main reason why people are presenting to our office for that treatment.
What are they seeing at home? What are what are their symptoms that they would see?
Yeah, they may experience hot
or
and cold
feel, right? Yeah.
Yeah, they may feel hot and cold sensitivity to drinks or certain types of foods. They may notice some inflammation or bleeding at the gum line, so that may be something that will prompt them to alert them they may have an issue. Something else is that they may notice different colors within their teeth. The enamel or the top part of the tooth has a whiter color. The root surface has a yellower color. So as people experience gum recession, the root becomes exposed. So the tooth may have one or two colors. Basically, the yellow color may now be apparent, and that may be something that the patients see. So when we have an issue with gum recession, we're concerned about, again, for the reasons I discussed, the main one being preservation of the bone that's there to support the teeth. So we have options on how to manage it. Ideally, we like to do what we call connective tissue grafting, which basically provides an aesthetic functional result, which will ideally cover the exposed root surface and provide a firm band of attached tissue that will be very protective going forward. We have a couple of options for tissue in that treatment option. We can utilize the patient tissue from the palate, because it's basically inside the premolars and molar areas, or we can go back in the areas of where the wisdom teeth used to be. This is the ideal way to manage this type of issue just because we get the best integration of the soft tissue grafting as it heals, aesthetically and functionally. We can use donor tissues as well, which has a great advantage where we only have one surgical site for healing for the patients. The downside is the donor tissue, whether it be cadaver, which is a human donor tissue, or animal tissues, they don't tend to integrate quite as well or to provide as firm of a protective layer of tissue in the sites. But that being said, it is attractive in that there's just one healing site for the patient, because where we put the tissue when we're doing this type of gum grafting doesn't really bother patients much. It's more so where we get the tissue that can bother them. But for the post-operative experience, we provide patients with a clear stent, kind of like a bleaching tray, which will cover the palatal site or the donor site to keep their tongue away from it so it doesn't irritate the site. So it can make the patients very comfortable during that process.
So I want to remark real quick, you said the different colors of the teeth, because I see this all the time, but somebody watching this, you're saying the lower the root of the tooth that should be covered is more yellow. I know sometimes people come to me and say, I have, the tooth looks longer, or they think that it's stained. And matter of fact, that's the root that's exposed, correct? That's what you're saying, the different colors. And that's when you had mentioned the palate, just for the audience, the palate is the roof of the mouth, correct? That's where you typically will get if you're using the connective tissue.
Correct, that's right, yes.
Okay, and then you attach it on there, and I know there's different types. You can get it from other human, I assume that's cadaver, or like you said, ideally you get it from their own body as it heals the best.
Right. One other option is to do a free gingival graft.
Oh, okay.
This is a more traditional way to manage gingival recession, where it provides a firm band of protective tissue right at the existing gum line. It does not cover the exposed root surface, so the healing is a little bit easier for the patients. There's less swelling on the site, but aesthetically it's not as ideal in that the color match is not the same. The tissue is a little bit lighter, and also the root is still exposed. But from a health standpoint, you don't have to have the root covered. It's more so just maintaining or providing a firm band of protective tissue that will withstand the rigors of function and provide a nice bacterial seal.
So it's a little easier to do that, and it sounds like what you're saying is it doesn't add the gums, it just supports the gums. It makes them stronger as opposed to putting it back. Is that?
There you go, exactly right. Yes,
Okay,
it's
cool.
just an additive procedure, correct? Yeah, and we usually reserve that procedure for the lower front teeth, because it's not really an aesthetic area, and unfortunately there's a strong muscle pull from your chin muscles that will want to retract the tissues when we're doing the connective tissue grafting. So the root coverage that we can achieve in other areas is not as predictable on the lower front teeth. So usually we'll do that second procedure, the free gingival graft, on the lower front teeth, just because again it's not as aesthetic. It's not an aesthetic area because you don't see it, and technically it's more challenging for the tissue to be maintained in a more ideal position.
What about with cosmetic dentistry? Are you doing grafting for people that are doing cosmetic dentistry, veneers, stuff like that? Tell the audience a little bit about that.
Sure, yeah. Gingival grafting or connective tissue grafting can be a nice adjunct to a restorative treatment plan as far as bonding upper front teeth or veneering or crowning upper front teeth, because the gum levels are very important when providing aesthetic dentistry for our patients. We have to make sure we have the correct proportions of the teeth and the gingival tissues or gum tissues. When they're not at the right level, that can provide some asymmetries or some discrepancies that people are going to see. So if we can level out the gum lines and put them at the appropriate levels, then that can definitely improve and complement the general dentist or restorative dentist fantastic porcelain work. So
yeah, I got to tell you, you taught me this, and I have to brag on you in closing. I think you gave me this little quote that it rings true all the time. The cosmetic work a lot of times is the picture, but the gum work around there is the picture frame. I don't know if it was you that told me that or somebody that was clearly smarter than me told me that, and it really brought a lot of things into light, because a lot of times you see these very fancy, tooth pictures of veneers and Hollywood smiles or whatever, and a large percentage, a huge portion of how nice it looks are the gums. It's the frame around the picture and how level they are. And I know you've done that for several of my cases. And one patient comes to mind who came to me, I don't know, 5-6 years ago. I hope you remember her. She came to me telling me, I have very long teeth. They're discolored, like you said. She was seeing the root surface. And she came to me wanting veneers and crowns and all sorts of very elaborate work. And fortunately, you're my friend, and I had talked to you about this kind of stuff, and you were teaching me some of the things that grafting can do. And I said, I think maybe this might be something that grafting can do versus me cutting up half your teeth and nubbing all your teeth and doing all the things that I do. And she came to see you, and I think within 1 or 2 visits, you did grafting all over her mouth, and she absolutely looks great. And I just saw her a few days ago. All her grafting looks great. We did not end up doing a single veneer. We didn't cut a single tooth. Everything about it was her teeth were very long. She had lost a lot of gums. I think probably it was hereditary in her case. She was very young. And to this day, she raves about it. I see her for cleaning. She's so happy about her teeth. And I'm sure she would do that over again 1,000,000 times, as she always tells me how happy she is with it. So I just have to close by bragging on you a little bit, because it's always a highlight case for me whenever I'm looking at cosmetic work or whenever I see some recession. First thing I think about is if we can do this very conservatively. The other thing with gum grafting, you're not cutting teeth, you're doing very, very conservative work, which anybody likes that word. And you can help out a lot. So, Scott, I really appreciate you being on the podcast. I hope anybody watching this learns something. Reach out to a periodontist or a gum surgeon, somebody who does this. Ask any questions on this YouTube channel. We'll do our best to answer for anybody watching this. Thanks a lot.
All right. Thanks so much, Renzi.